Assalamualaikum warahmatullahi wabarakatuh, and good evening, especially to our panel, Dr. Siti Hajar and Dr. Amaliawati. My name is Izzati binti Azlan, and today I'm going to present about my article review entitled Prevalence of Virulence Genes in Klebsiella pneumoniae from Hospital-Acquired Infection. Okay, let's start. Before I start, I'm going to introduce about Klebsiella pneumoniae. What is Klebsiella pneumoniae? Klebsiella pneumoniae is a gram-negative bacteria, which is actually it is a normal flora in our guts. Unfortunately, it is an opportunistic pathogen which can cause disease of Klebsiella pneumoniae when our body gets sick. Okay, it is an encapsulated and non-mortal. It is usually found in pneumonia and diabetes mellitus patients. The symptoms infection of Klebsiella pneumoniae including fever, neck stiffness, yellow-green mucus exhibited, and the patient usually has a light sensitive. Azur et al. In his 2020 article, he has found Klebsiella pneumoniae from the lungs of people who had died of pneumonia. He described it as an encapsulated bacillus in 1892. This is the problem statement. Klebsiella pneumoniae is the most prevalent cases of hospital-acquired infection in the United States, accounting for 3 to 8% of all nosocomial bacterial infection. Antimicrobial resistance in Klebsiella pneumoniae also is a major health concern nowadays. This is the importance of the research. In hospitalized patients, the carrier rate of Klebsiella pneumoniae is much higher than found in the community. Klebsiella can enter the body through various medical tools and end up causing infection in hospital environment. It can also lead to a fatal infection. Okay. Azur et al. 2020 in his article, it says that carrier rates as 77% can be seen in a stool of those hospitalized and are related to number of antibiotics given to the patients. Klebsiella pneumoniae in hospital-acquired function. As we know, the disease caused by Klebsiella pneumoniae is spread by direct contact, and according to Center for Disease Control, healthy person does not have to worry if they will get the infection of Klebsiella pneumoniae, because usually Klebsiella pneumoniae does not affect healthy people. Okay, but people with compromised immune system, as well as sick or injured people that are having treatments for a few health conditions are easily infected by Klebsiella pneumoniae. Okay, this is because the main reservoir of infections are the patient, GI tract, and the hands of hospital personnel. According to the article by Azur et al. In 2021, those who develop pneumonia by Klebsiella pneumoniae, usually they are on ventilator. Between the percentage is 8 to 12%, and only 7% occur in those patients who are not ventilated. Okay, patients who had alcoholic habits and had septicemia are likely to have a mortality range from 50 to 100% pneumonia. This means that people with bad habits, for example, alcoholic or smoking behavior, it is usually they can exhibit a fatal infection of Klebsiella pneumoniae. This a case study reported about a 72 years old man with chronic hepatitis due to hepatitis C virus attended the emergency room with fever and pain in his hypochondrium. As a result, Klebsiella pneumoniae has obtained from blood and liver abscess culture. This is a case study by Lopez et al. In 2019. Okay, this is the data provided from the article. As we can see, there are a few cases, example, in a few countries, and there are references. As we can see, in Malaysia, there are articles about bacterial isolates relation to Klebsiella pneumoniae identified in general ward from 2000 to 2004. This is by Law et al. In 2007, and it is about hospital-acquired infection. As we can see, this is the most recent article talk about Klebsiella pneumoniae in hospital-acquired infection, and there are another two about Klebsiella pneumoniae in hospital-acquired infection and community. That is Portugal, Ireland, and Europe country. Okay, as we can see on down here, we can see that this is the graph show in 2000 to 2004 in Klebsiella pneumoniae in general wards. In Malaysia, as we can see, it is increasing until 2002, but it decreasing until 2004. Okay, these are the viral factors of Klebsiella pneumoniae. As we can see the picture above, there are type 1 febrile, type 3 febrile, there are capsule and hypercapsules, high siderophores, and there is the difference between classical Klebsiella pneumoniae and hypervirulent Klebsiella pneumoniae. This is their role in epidemiology and their references. Okay, in 2014, Naigo Navarro et al. Has discovered that over half of the 40 carbamonium resistant Klebsiella pneumoniae bacteria could form visible biofilms. Okay. Okay, these are the antimicrobial agents and the resistance percentage and their references. As you can see from the table, fluoroquinolones has the most resistance percentage and followed by aminoglycosides, carbapenem and tetracycline. Okay, a report in 2014, WHO has highlighted that resistance to first and second line antibiotic is already increasing. On last resort antibiotics, that is carbapenems. Okay, the most complex and crucial drug-resistant bacteria are CRKP and ESBL positive Klebsiella pneumoniae strains, which have limited treatment choices and have a high death rate, according to the Lee et al. In 2021. This picture shows the carbapenem resistance of Klebsiella pneumoniae infections around the world. Okay, we see that this data collected is from WHO in 2014, Center for Disease Dynamics, Economics and Policy in 2015, and Pan American Health Organization. This data is from 2011 to 2014. This is the research graph. From my point of view, I think more antibiotics have to be discovered by scientists to fight against Klebsiella pneumoniae infections. As Klebsiella pneumoniae, it can be the most fatal bacteria if not treated on the early stage in comorbidities patient in hospital. This is my recommendations, which includes more research into the virulent factors of Klebsiella pneumoniae and how to effectively to counter them, and scientists also have to develop a new antibiotics to combat Klebsiella pneumoniae in the near future, because the fact that many antibiotic has been resistant to Klebsiella pneumoniae is so frighten the world. Okay, these are the references, and the next is YouTube videos about Klebsiella pneumoniae infections in hospital acquired.
A loved one or a friend gotten more sick by being in a hospital. We know it happens. 1 out of 25 hospitalized patients contract an infection from exposure to bugs in the facility. We call these nosocomial or healthcare acquired infections. In the US, 1.7 million healthcare associated infections are connected to about 100,000 deaths per year. So, what are the greatest infection risks in hospitals? Ironically, 4 of the most common types of hospital-acquired infections are caused by the devices and procedures employed to care for patients. Urinary tract infections contracted from catheters are the most common type of infection. Surgical site infections are the second most common and are generally caused by touch contamination. A lung infection, known as ventilator-associated pneumonia with the use of a ventilator, holds the highest mortality rate. And finally, bloodstream infections are a persistent danger. Those that stem specifically from vascular catheter use are especially deadly and the costliest of all hospital-acquired infections. So, what are hospitals doing to keep you safe? Well, even small precautions can have big effects. Hand washing, for example, is highly effective in reducing the risk of touch contamination from caregiver to patient. Likewise, a simple checklist of best practices used while inserting and maintaining venous access catheters has been shown to greatly reduce avoidable and costly bloodstream infections. The checklist includes steps like using a full sterile barrier, including mask, cap, and gown during insertion, ensuring that the access port is disinfected prior to each medication administration or blood draw by scrubbing or using disinfecting port protectors, and being sure to remove any catheter as soon as it is no longer needed.
With that, I really thank you for listening to my presentation today.